Mr. Thahane, as a government official, how do you, how does this cost of inaction, how does it affect your thinking and your work?
So sometimes in public policies, you have to make decisions, and decisions sometimes on incomplete information, but they have to be made. And the concept of the cost of inaction, perhaps in some ways we try to think of it in making decisions, especially in finance, because there are limited resources and you have to make a cut-off somewhere. And then the question becomes, what do you cut off? You can use the opportunity cost analysis and benefit cost analysis that economists use, but sometimes you cannot quantify all that you forego by making a particular decision. So practically, I will make 3 points. If you look at children or population in Africa, it's a young population, and a large number of those is children, whether they are between 14 and 24, or you start from 1 to 5. And so the question becomes, can you have viable societies in Africa that are capable of innovation, capable of good life and everything else, if you don't invest in those children? And it is in that frame of mind that this analysis and the concept becomes very helpful to policymakers. Let me take from which are the examples in the book are many, but if you take HIV and AIDS, the direct effects of giving that child the antiretrovirals, and you see that child becoming better and living a normal life, and therefore contributing to society. You have the direct, the indirect, subsequent consequential effects. Then you take the mother. If the life of that mother or father can be extended through the use of antiretrovirals or whatever it means, then they will be able to bring up their children, and society benefits. So the cost of inaction would probably be not providing the antiretrovirals, or just letting those children and saying it's too expensive, or if they have to go to second line drugs, you say it's too expensive. But it's too expensive for what?